Like all of us, you probably love the warm sun on your skin when you go on vacation or visit the beach. Sun's rays make us feel good and in the short term make us look good. But our love affair isn't a two-way street. Exposure to sun causes most of the signs of aging and can even be deadly. Skin cancer is more rampant than ever, and with new lotions and blocks on the market, how can we know if we're being truly protected? Please join me and a group of skin cancer specialists as we turn the examining light on skin cancer and see how we can protect ourselves this summer and beyond. I'm Roland Smith, and this is CHS, Long Island's Health Source. With me now is Dr. Joshua Fox, attending dermatologist from St. Francis Hospital in Roslyn, and Dr. Vincent DiGregorio, who is the attending plastic and reconstructive surgeon from Mercy Medical Center in Rockville Center. Welcome, gentlemen. Thank you very much for being with us. A very interesting topic today, skin cancer. Let's start by defining the types of skin cancer that can occur on, I guess, any human being.
Okay, we see in this picture here that this is the epidermis, the outer layer of the skin. This is the dermis, the intermediate layer of the skin, and this is the subcutis. Within this epidermis layer, there's 3 different cell types, each of which can turn into skin cancer. There's the melanocytes, these little brown cells. These turn into melanoma, the most dangerous type of skin cancer. Then there's the keratinocytes, in between layer, those turn into squamous cell, the second most dangerous type of skin cancer. And then those on the basal layer, the bottom layer of the epidermis, these turn into basal cell, the most common type of skin cancer, which is the least dangerous.
Now you're saying they turn into, that means they can turn into it, but they don't necessarily will turn into it.
Right, they rarely turn into it, but
okay.
That's the cells that that's what they could turn into.
It's important to understand that skin cancers are the most common of all cancers in the United States, reaching epidemic proportions. And that basal cell carcinoma, as Dr. Fox would indicate, represents 75% of all skin cancers, but are easily managed with by local management. Squamous cell carcinomas, as Dr. Fox had said, are a bit more aggressive and represent somewhere around 20%. And the minority of skin cancers are malignant melanomas, which can potentially be fatal if not dealt with swiftly and appropriately.
Now, how are these particular cancers caused? In other words, is it always the sun? That's what we keep hearing, mostly today from all of our news reports.
I would say that the sun is probably the major etiological factor, and the amount of ionizing radiation that one gets is cumulative in one's life. I often tell my patients it's sort of like the amount of radiation that you get is sort of like pouring water into a glass, that ultimately the amount of radiation that you get spills over and produces malignancies, basal cells, squamous cells, or malignant melanoma. And these are reaching epidemic proportions, especially in certain parts of the world. A good example is the experience in Australia, where Celtic individuals, people of Scotch-Irish blood, or genetically moved there to a subtropical environment, exposed to sun with a very outdoor type of lifestyle, and malignant melanoma is now reaching epidemic proportions in Australia and New Zealand.
Just to add to that is that about 30 years ago, the risk of developing melanoma was about 1 in 1,500. Now it's approximately 1 in 68. So we see how drastic this has increased the rate of incidence of malignant melanoma.
Well, you brought some pictures with you that can show the certain types of cancers on the skin. Let's go through some of those at the moment and describe them for me, and I guess what you're looking for.
Yes. This is a basal cell. It's an example of a rodent ulcer. It's ulcerated. Sometimes it's crusted, It's often picked at, it's oozing, it's bleeding. And this is something that if one person saw a non-healing sore on their skin, that's something they'd want to show to their doctor. Next slide, please. Yeah, this is an earlier stage. One sees that it's translucent. It looks pearly. One sees even the blood vessels coursing through it. And this is an earlier stage of a basal cell on someone's forehead. And this is easily treated. I think the point I also wanted to make here is that a pigmented basal cell can often be confused with malignant melanoma. And therefore, many people will be afraid to seek treatment thinking that they have a more deadly disease. Well, in fact, this is easily treated.
Fear is a big factor, isn't it, in either both understanding the need to get checked over and then treatment following it.
This young lady appeared at my office probably about a year ago and had a basal cell carcinoma, and this is an ulcerated lesion on the side of her nose. She had this for at least 2 years, had had it biopsied, knew indeed that it was a basal cell carcinoma, yet based upon her fear of this spreading and causing death and or fear of being deformed by the surgical procedure, did not seek care. So in this instance, we're treating somebody who, we're treating both her skin cancer and her fear. And these are both difficult and both must be managed. She was fortunate in that I explained to her that it was a readily curable disease, that she ultimately, we could remove this based upon the fortunate location of it, and she would wind up with a result which would be undetectable. And the next slide is an early slide after reconstruction. She just has a small scar there which ultimately will disappear. But I think Ronald, you bring up a good point, that fear of treatment, fear that this ultimately will result in the patient's demise, frequently keeps patients away. And as Dr. Fox had indicated, early detection, early treatment is really what we're seeking to do and the purpose of why we're sitting here today.
Indeed. Now, once you allow the fear to take over and you don't seek treatment, does there come a point where it's either fatal or far more serious than had you not done anything?
It depends upon the type. As Dr. Fox had indicated, basal cell carcinomas are rarely fatal. Basal cell carcinomas, representing 75% of all skin cancers, are rarely fatal. However, they cause destruction by inattention and local extension. As Dr. Fox had indicated, the one that he showed before had an ulcer. And in an unflattering term used early in medicine, where these were described as rodent, R-O-D-E-N-T, ulcers, meaning that it just gnawed away at the patient. We rarely see that now. However, I can remember historically many years ago to see people with huge, enormous basal cell carcinomas, which required heroic reconstructive efforts. But basal cell carcinomas rarely kill people. They just need to have attention early on to rid the patient of disease and have minimal cosmetic consequences.
Just to follow up, squamous cell kills approximately 2,500 people a year, and malignant melanoma kill over 7,000 people a year. So they are potentially fatal, and therefore you want to catch it in the earliest possible stage so that you have the best chance of cure, which, by the way, in our practice, most all of them are cured because we do try to catch them in the earliest stages.
Can a basal cell move into a squamous cell or a malignant melanoma?
No, they're three pretty much separate disease entities. So the basal cell just become more aggressive. They may spread into the eye or affect the bone. They're more, as Dr. Gregorio mentioned correctly, that they may be they may extend deep and damage local structures.
Okay. I'm sitting at home and I'm listening to this and I say, well, I'm looking at my skin. What do I look for? I mean, how does the amateur, how does the layperson, I mean, you guys, if both wonderfully medically trained, know what you're looking at. I wouldn't have the slightest idea if I'm looking at my body what I'm looking for.
Well, I would say the American Academy of Dermatology and the National Cancer Institute, they recommend yearly skin exams so that when you go to your family doctor or dermatologist or whoever you go to for your